All right, today we are jumping right into a condition that affects newborns when they're at their most vulnerable, Hirschsprung's disease. We're going to break down what it is, what causes this so-called broken signal in the gut, and how modern medicine actually steps in to fix it.
So, I want you to imagine the gut as this perfectly engineered machine, right? Signals are firing, everything is moving along just as it should. But what happens when that crucial go signal is missing right from day one? Well, that's the very heart of Hirschsprung's disease, and we're about to dive in.
So here's our game plan. We'll start with the basics, what this disease actually is. Then we'll get into the cause, that missing signal. After that, we'll look at the key signs to watch for, and wrap up with how it's diagnosed, treated, and what that road to recovery really looks like.
All right, let's get right into it. First up, what exactly is Hirschsprung's disease?
So here's the bottom line. Hirschsprung's is something a baby is born with, and the whole problem stems from a lack of these very specific nerve cells called ganglion cells. You can think of these cells as the little green lights that tell the gut, okay, time to push. Without them, a section of the colon never gets the message to squeeze, and you end up with a major traffic jam.
Now you might hear this condition called a few different things, so it's good to know the lingo. Congenital megacolon literally points to the fact that the colon gets enlarged from the back up, and aganglionic, well, that just means without ganglion cells. Knowing these other names is super helpful, especially if you're digging into the research.
So we know what it is, but the big question is, why? Why does this happen? This is where that idea of a missing signal becomes absolutely central to understanding the whole thing.
And this slide lays it out perfectly. On the left, you've got a healthy intestine. It has the ganglion cells, it gets the signal, and it performs peristalsis, those muscle contractions that push everything through. But on the right, with Hirschsprung's, that signal is just gone. No signal, no movement. It's a really simple breakdown of a problem with huge consequences.
And it truly is a domino effect. See, it all kicks off with those missing nerve cells. That leads to no squeezing action, which means stool can't move, so it backs up. And as it accumulates, the healthy part of the bowel just before the blockage starts to swell up, and that's how you get a megacolon. Eventually, you have a complete obstruction. Now, we don't always know the exact reason these nerve cells don't form, but we do know some clear risk factors. For one, it's about 4 times more common in boys. Family history can play a role, and it's sometimes seen alongside other genetic conditions like Down syndrome, which gives researchers some really important clues about its origins.
Okay, so that's the mechanics of it. But what does it actually look like when you're looking at a newborn jaundice? Let's talk about the telltale signs, because catching this early is everything. In a newborn, clinicians are on high alert for a classic triad of signs. Number 1, the baby doesn't pass meconium. That's their very first dark, tarry stool within the first 48 hours. Number 2, their belly looks really swollen, almost tight like a drum. And number 3, they're vomiting a greenish-yellow substance. This is called bilious vomiting, and that color is a huge red flag because it means stuff is backing up all the way from the small intestine. Now here's a really interesting and very specific clue that doctors look for. Sometimes, during a gentle rectal exam, the physical pressure can kind of force open that tight, nerveless section of the bowel. And when that happens, bam! You get this sudden, explosive release of all the trapped stool and gas. It's famously known as the squirt sign.
And we need to be crystal clear about the stakes here. This isn't just a bad case of constipation. That massive backup can trigger a really dangerous, widespread inflammation of the intestine called enterocolitis, and it can absolutely be life-threatening. This is exactly why early diagnosis is so critical. Okay, so we know the signs to look for. Now, how do doctors confirm the diagnosis? And more importantly, what is the fix?
So, while things like X-rays can provide strong hints, the one and only way to be 100% certain is with a rectal biopsy. It's the gold standard. A pathologist takes a teeny tiny piece of tissue from the colon and looks at it under a microscope. If they see a total absence of those crucial ganglion cells, that's the confirmation. It's also really important to know that the disease can vary in severity. As you can see here, the vast majority of cases, we're talking 80%, are short segment, which means it only affects the very last part of the colon. But in some rarer cases, it can affect a much longer section, or in about 5% of cases, the entire colon. When it comes to treatment, there's really only one definitive path forward, and that's surgery. The goal is actually pretty straightforward in concept. You remove the section of the bowel that just isn't working, the part with no nerve signals, and then you connect the healthy working part directly down to the anus. This is what's known as a pull-through procedure. Now, the surgery is obviously the main event, but the care that happens before and after is just as critical to make sure everything is successful. So let's take a quick look at what that involves.
Before that surgery can even take place, the baby has to be stable. That means relieving that dangerous obstruction, usually with a tube and special irrigations to clear things out. It also means keeping them hydrated with IV fluids and giving them antibiotics to prevent that dangerous infection we talked about earlier.
And after the surgery, it is all about careful recovery. The team monitors for any signs of infection, makes sure the bowel starts working again, manages pain, and slowly reintroduces feeding. But a huge piece of this puzzle is educating and supporting the parents, because they're on this journey every single step of the way.
Which brings us to our final thought. When you think about it, if the fundamental problem is faulty wiring, isn't it kind of amazing that the solution is basically a biological rerouting? We're literally bypassing the broken part to get the whole system back online. It is a really powerful example of how surgery can restore a basic, vital function and give these kids a shot at a completely normal, healthy life. Thanks so much for joining me for this explainer.